So for those of you that don't know me, my name's David Ford. I'm Professor of Informatics at Swansea University, and I do a number of things, including running the SAIL data bank, but I also am quite involved in many of the programs that HDR UK run. And it's an honour to be involved in those and indeed this symposium today. This is the first of your parallel session experiences. I hope it's going to work okay for you. I think we're planning to give you an interesting time. So you will see that I'm joined by an illustrious and a fearsome panel of experts. And our job today is to kind of try and unpick the subjects. I'm going to make sure I get the right terminology here. Unpick the subject of streamlined access and authentication. I'm going to introduce the panelists in a moment, and also I'm going to ask them each to say a few words about the subject from their own various perspectives. And as you'll see, those perspectives are different, which will hopefully make for a stimulating conversation. But for those of you that are sort of research practitioners in some way, and I suspect quite a number of you are, then getting quick and convenient access to data to use in your research endeavours is probably a pretty high priority on your lists. And I think it would be fair to say that in the past, this has not always been as simple or as quick or as easy as you might have liked. And so today's an exploration of why that might be, and also trying to have to put some thought to how we can make this better. But the observation I would make is that if you've ever experienced a slow, cumbersome, time-consuming process to get access to data, that is largely because it's not as simple as it might seem. All of the practitioners of running TREs or their equivalent essentially are providing safeguarding activities for data of which they are custodians, and they go through processes with the best intentions to make sure that those data are used as they should be. Having said that, they can always be quicker, faster, and so forth. So today is to try and work out how we can balance those different dimensions, really those sort of kind of things that we must do to make sure data is used in a trustworthy way, but also how can we improve that for, particularly for the research users who wish to gain access to it. So I don't know whether you've kind of been instructed on how these experiences are going to work, but we are going to say a few words. Well, I'm almost finished, so I'll shut up in a minute and I'll introduce my colleagues to say a few words. And when we've finished, we'd like to really start to address any topics or that you might be interested in posing for us. So it's very much interactive, albeit the level of interaction is somewhat constrained by the technology. So you will notice, if you're not familiar with Zoom already, there's two ways that you can communicate with both us and with your fellow attendees at large, and that's by using the chat function. So by all means, feel free to use that to make observations. But if you have a question you'd like us to address, either a single individual on the panel or us together, which we would be delighted to do, please do try and use the Q&A button, because that will isolate your question from general, as it were, chat and make it easier for us to pick it up and make sure it gets answered properly. So the Q&A button for questions, and to some extent we might use them for answers if we get overwhelmed, and then chat for more sort of observations. I would just sort of say that sometimes these are sufficiently scaled to be allow people to sort of ask their questions with their microphones on, but we're going to ask you not to do that this time and to use both those functions, and we'll do our best. So the panel, and this is the meat of the meal. So as I said before, a really incredibly appropriate panel of experts in the field. We're joined today by Alex Baley, the Programme Manager from the Medical Research Council's support unit. Sarah Henry is Director of the Methods of Data and Research at the ONS, and which, as you know, operates their secure research service. Phil Booth from Med Confidential, advocates for patient privacy and trustworthy reuse of data. And Garry Coleman, Director of Data Access from NHS Digital. So a good cross-section of people who both have got expertise in the domain and looking down on what some of us like Gary and I and Sarah do for a day job, and making sure that we try and do the best job we possibly can. So I really want to encourage you to ask questions. So as they go through their very short presentations and throughout the rest of the time we have together, do ask any questions that into the Q&A box, and we will attempt to address them. Good. So without further ado, if that's all right, I'm going to shut up and I'm going to hand over to Alex, who's going to kick us off. Thank you, Alex.
Thanks, David. As David said, my name's Alex Baley. I work for the Medical Research Council's Regulatory Support Centre in Edinburgh, and we've got an interest in promoting research governance and research in the UK. So in other words, we like to talk to people about the principles, the rules, the regulations, the law, the policy, all the things that make getting hold of health data in the UK difficult. And we do that really to try and help people be on the same page, understand things, make things easier, streamline as much as possible. In some ways, we shouldn't exist as a unit. It should be simple. You should be able to press a few buttons and have data available on your laptop. The fact we've existed for a decade indicates, as David just said, it isn't necessarily an easy area to navigate as a researcher or as a data provider. And we know one of the things that makes access to health data complicated is understanding two specific laws around it. One of those is around confidentiality, and a great disservice to years of case law. But in brief, you can share health information, confidential information, within someone's reasonable expectations. In other words, somebody shouldn't be surprised that their health data has been used for a particular purpose. There's another law that says you can use data subject to lots of conditions, but one of those conditions is you need to be transparent, open and honest about how that data is being used. And it's understanding what those mean, the black and white of the law, interpreting that into practice. So as a researcher, you're looking at your research project. How do you know what the UK's population reasonable expectations are? As a data provider, wanting to hand data out to researchers or provide access to, how do you know what level of transparency is appropriate for any particular studies? And when we know that confusion over that, misunderstandings around what needs to be done, can slow the access to data, very occasionally stop access to data for health research, which is something I don't think any of us want. So I think the questions I have really are, do we know what the public's reasonable expectations are of the use of their data for health? Has that changed over the past 9 months, given that data's on the TV and on the internet every single day relating to COVID? If we don't understand reasonable expectations, what do we need to do as a community to get a handle on that? How do we keep a handle on that? Because we would hope expectations might change. And in terms of transparency, how clear is it to the public how their health data is used, full stop? And that some of that data might be used for research purposes, and BHDR's intent that as much as possible will be used for research purposes. So as a patient going into hospital and watching somebody tap in details into a computer, is it clear that that data will end up in some form being used by a research university, and exactly who in that university? Some of that data may find its way to commercial companies because the NHS contracts commercially. It may end up in a central database to do audits or evaluations, that kind of thing. How clear is it to the public that that happens? There's nothing to hide. I don't think anyone's got anything to hide here, but I think we could be better in being transparent, being able to explain and how health data is used. So just to come back to the title of the whole session of all of us together, it's difficult to see that unless you expect to be in it together and it's clear and it's open why we're in it together. And that's coming close to my 4 minutes, David.
Alex, that's masterful and a great kickoff, really. I think putting the public in the spotlight from the off, because I think that they clearly are really, really important stakeholders in this. So thank you for that. So we're going to now move on seamlessly to Sarah, who's going to give us a view of someone that's responsible for a lot of this as a day job.
Morning. Thank you, David, and thank you, Alex. I feel that was an excellent introduction, and I'm very happy that you've gone first. So I'm Sarah Henry. I'm the Director of Methods, Data and Research at the Office for National Statistics, and one of the areas of my responsibility is the Secure Research Service, our trusted research environment. This is a system that's been running for many years now. We've invested in it in several iterations, and I reflected as I was preparing for this talk of ours, that actually it's actually performed quite well, and I had quite a few sleepless nights at the beginning, because we ended up from started off from an environment which served researchers, probably not at the pace that they wanted us to serve them, but it was a steady pace. And suddenly the pandemic started, and we had to stand up a huge survey. It was £650 million, one way of measuring it, on the Secure Research Service in a collaborative way, something that needed to run at pace with really ugly code that takes a long time to run, mucky data that's coming in all the time and needs to be cleaned. And actually, although we've stumbled a couple of times, it's actually really stood the test. Now, don't get me wrong, it needs investment, it needs the data access needs improvement, but having an environment that we can stand something up on quickly really worked. So I'm very proud of that. The other thing that I reflect on, which I'm also very proud about, is that there are two pillars of democracy that are at play here. One is that researchers from anywhere really can actually access data. Okay, you've got a few hurdles to pass, but at the end of the day, the government isn't restricting access to researchers, it's making it available. The other thing that we've managed to protect is privacy. We have not actually required any change in legislation in order to enable access to our research. So we are all operating now under emergency powers. There's lots of components of our freedom that are quite restricted, but we are still committed to privacy and to protecting data. That's what differentiates us, or our democracy, from many other countries. And I think that we should remember that as we step forward and talk about how to improve access, how to make the process easier for researchers, how to grow the research community, how to help us collaborate better. But collectively, as a community, we've certainly achieved a lot. We've definitely collectively informed decision making. We've certainly informed debate, and we have collectively still protected privacy. So a big pat on the shoulder to all of us, and I'm including in that all the participants and certainly all the colleagues that we're working with across government who've helped make data available. So in the Secure Research Service, you've got at the moment a combination of administrative data that comes from predominantly test and trace, some other health data as well, and our infection survey as well. And for me, really the next conversation has to be about the quality of that data, the production of statistics from that data, and asking ourselves, what helps debate more now? Do we need experts analysing that data, producing statistics, putting those in the public domain with a very clear explanation of what exactly is being presented, versus the attention on more access to a lot more researchers? Is there attention there in terms of our bandwidth, etc.? How do we turn the data that we've got into something that we're communicating and is informing debate? So that's my contribution, and I look forward to engaging with you in this very virtual way. Thank you.
Thank you, Sarah. That was terrific. It included a bit of a stirring a call on our national pride. We're doing great. Good for us. Yeah, good. Thank you. I mean, good. Lots of interesting points in there to pick up on as we move forward. And you'll see the way this program's been organised very, very thoughtfully, interleaving people that have to do the job with experts that observe how we do it. So now moving on to another expert in the field, Phil Booth. Phil, your turn.
Thanks, David. And thank you everyone for attending the session. Good to be here. I'm Phil Booth. I coordinate Med Confidential, and Med Confidential seeks to ensure, quite simply, that every use of patients' data is consensual, safe, and transparent. I don't think anyone really disagrees with those. We certainly believe, and have since the beginning, that ethical use of data, ethical delivery of care, and ethical research, there's no conflict between those. Yeah, we just have to actually get the rules and processes right, and then these things can be done. I suppose I'm going to take an angle because I'm from, as David says, a bit outside of each individual body or system. And so we tend to take a look at things. So we're aware that the rules are different, say, in Scotland, Wales, Northern Ireland, England, and that there are different trusted research environments, or what we call safe settings, in operation. And so we sort of look to the same sort of principles as Alex mentioned in his introduction. There should be no surprises for patients. And we've certainly, actually, I think in the first time I gave evidence to Parliament on this topic, back in 2014, we actually made reference to the ONS's safe setting as a model for how things should be done. So it's encouraging to see people moving towards ways of doing this. Now, to go to the sort of the bit of the topic that we're talking about streamlining here, I think I'd like to make or introduce 2 points. One is that, and as David has said, there are different data custodians or data controllers. HDR UK is not a data controller. So we have a body, an initiative, a way of doing things here that could, if it chose to, actually help smooth out the bits of the process that are actually more smoothable or automatable or capturable. Yeah, all of that data and metadata that you need to make an application for data, for access to data in one place, could that be replicated for other places? When you have linkage, you're talking about 2 data sets. So, if that process has been gone down once, where can that process then start to set precedents for all? So what I would see both HDR UK and, frankly, the trusted research environments themselves as doing is, rather than putting the burden of some of these things around transparency and consent, which we haven't really mentioned, onto the individual researcher, research group, or research project, it would be better to think of the trusted and hopefully trustworthy research environments doing that stuff, so that when you get access, you can know that this has been done. And more than that, because this is actually an end-to-end process. It doesn't just end with gaining access to the data and you doing your research with it. It is actually feeding this back to the people whose data it is, the public, the patients, what have you. Transparency is not just about, hey, what have we got? It's what have we done? We want to be engaging and, frankly, educating the public about the research endeavour. And I firmly believe, and have for years, that in providing people with that feedback from what has been done, which can be captured by the research environments, which are clearly beginning to develop and developing capabilities, this can be reported in a way that actually brings people in to the endeavour. And we can change this to a slightly different conversation than some of the ones that we've been having over the past decades. Anyway, I just want to sort of have that that injection. The other final other point is this emergency powers thing. There has been, we are under the pandemic. We have the COPE notices that has given some quite extraordinary powers to do some quite extraordinary things. Yeah. I don't want people to think that we can be in some state of constant emergency. I think that would be the wrong conclusion to draw here. but we need to look at what it is that we were actually able to do when there was a specific purpose. Yeah, and see how we can put the information governance that is required around ways of doing things safely. And I encourage those who aren't aware of it to look at something like, for example, Open Safely, which is a sort of new model of processing data in situ on the GP IT provider's sort of server farm, where all that comes out, as with ONS, is statistics, but where you are actually able to ask questions of very large sort of populations of people. Yeah, so we will have had some innovation. Let's make sure we don't lose it. Let's make sure we learn from it. And you know, the biggest lesson that we have to learn is that we are able to do things if we have invested in it.
Wonderful, Phil. Thank you very much. That was very helpful. So, and now, some interesting points that we can pick up on, I think, as we have a discussion afterwards. And now, finally, but certainly, but not least, Garry.
Thanks, David, and good morning, everyone. It's one of the benefits of going last. You can listen to what everyone else says and nod enthusiastically and agree with everything being said, and then realize you've got 4 minutes and you've got nothing else to cover because they've covered it. So I want to take a slightly different view. I wanted to share with you perhaps a bit of a therapy session. We've got 51 participants here. So can I share the things that are keeping me awake at night around data access? And then perhaps a brief talk about some of the things we're trying to do to solve it. So the last 9 months or so have been probably well, without doubt, the busiest I've ever known in my career. Not obviously for the reasons that we all have around isolations and tiers and all that kind of thing, but in terms of the data side, the number of new flows being established, the number of new legal bases being identified for those flows, the different organizations undertaking different roles that perhaps are very unusual and not fitting where we were, say, a year ago, has created some real big challenges. To enable them because there was good work being done, clearly, but also to try and establish new data sets that can then flow and be made available to researchers. And David, you started the conversation by saying, you know, this is sometimes a little bit difficult. Yeah, it really is when you've got data sets that you're trying to collect, process, curate, make available for researchers, and enable the researchers to gain access to those in a way that has the data set linked to other existing data sets in a way that makes sense, because there's no point getting a data set out there and available for linkage if the way we've done the linkage or the longevity of that data set is sort of measured in days, weeks, not months and years, because researchers quite clearly will take a longer view about the research they're undertaking. So we need to make sure we support that. And we've talked about trusted research environments and different ways in which we can make the data available in a more secure way. And that's fabulous. And NHS Digital, as you'd expect, has a trusted research environment. But the challenge we've got is how within that environment do we enable linkage between NHS Digital and ONS and all the other safe havens for data throughout the UK as well, given that each of us have different legislative bases, different approaches to linking data, and different approaches to giving access to that data. So, sort of Associate Director for Data Access at NHS Digital, my challenge is how do we resolve that? So what we're doing is creating an access program, which is changing the way that we'll make that data available, focusing very heavily on the trusted research environments, looking afresh at how we can speed up access to that data, making sure that we remember the lessons of the past. I've been there, I've suffered some of those pains over the years, but we need to move on and make sure we retain public trust, but get the data out there and usable by colleagues. And I'd posit that data access is more than simply the trusted research environment or the access bit, the data sharing agreement at the end, but is very much improving the entire end-to-end journey for data, for how we collect it, process it, curate it, link it, establishing the data quality around relating to it, and then finally making it available for researchers. And being able to do that, we probably can create a sort of a research data ecosystem that can exist and sustain beyond the existing pandemic.
Fantastic, Gary. Thank you very much. So, and that's our sort of little introduction, just to kind of get us all warmed up. We're very keen to hear questions. They are, I believe, coming in. And Insa, I believe you've got your hand up, which is quite normal in a Zoom thing, but actually we're not doing it that way today. So if you haven't put your question into the Q&A box, please do so, because we'd be delighted to hear it that way. I'm going to take the privilege of being chairing to sort of fire in the first question as our panelists, but it is important that we manage to cover the ones that are coming in. So I'd just like you to maybe comment a little bit about this making sure we get it right. So there's clearly in providing access, we have to square off various things. We have to square off the law. We need to make sure it's legal, and that, as Alex and others have said, that's not always crystal clear, and so we need to kind of clarify that. We also need to square off public opinion. That was very clearly made well. So we have to make sure we're on the right side of public opinion. Not always easy to understand what that means, as we heard. And then actually there's a third stakeholder, is it? Because individual organisations that contribute data to research, hospitals, government departments, and so forth, often have their own opinions about what data should be used for and what it should not be used for, and under what circumstances it can be shared and what sort of research it can be supported. So there's at least three kind of views which we're trying to reconcile here and present a reconciled opportunity for researchers to engage with that data. I mean, is this something which causes a practical problem for any of the panelists about, these not necessarily identical stakeholder opinions?
Yeah, that's absolutely right. So it's the nature of the landscape that we do need to deal with every data custodian separately, and they've each got their own requirements and their own stakeholders, their own risk appetite. All of these things are not uniform across all data providers, and they also relate to what the researchers want to do with the data. So even if they were uniform, there'd still be a differentiation because the use of the data is different, and all that lends itself to a very complex environment. So there is some work going on through some investment that the government is making to try and improve the situation in terms of including some standards, maybe trying to streamline some of the access. However, I'm not sure that that's a quick fix, and the reality is, certainly as we're dealing with the pandemic, is that we just need to put a lot of effort into managing all those suppliers and respecting where they're coming from. Where we can, we try and recycle, so to speak, the way of working. We try and share good practice, etc. But this is the reality that we live in, and we just need to accommodate it.
Yes, it is. Anybody else want to come on that particular topic, or shall we move on to one of the? Garry,
I'd probably just comment on the public opinion piece, and going back to something I think it was Phil who mentioned earlier, the sort of emphasis on transparency and openness. I think the public is immensely sensible, and will understand what is being done, but will get very concerned, quite reasonably, if they feel that we are not being transparent and open. And we've taken an approach of publishing our audits, for example, of where we've done them with data access and things like this. And sometimes that isn't to our benefit. Sometimes that can be a bit painful, but it is still nonetheless the right thing to do, because people then will start feeling more trust in what's happening with the data, and we're continuing to do that throughout the pandemic to make sure that people are aware of what is happening. So I think there are some things that we can learn from before that we should continue to make sure happen, even if, again, it's difficult so to do.
Yeah, thanks, Gary. I mean, that's a fantastically fortuitous segue. I mean, I think, Phil, I'm just going to draw our attention to the first question, because it's a kind of a zoom in on this particular issue. And maybe, Phil, you could respond to this one, and perhaps a more general point you want to make as well, which is from Jennifer Jones, who's asking, how accessible do you think outputs from research actually are? And I think they're thinking about a public accessibility here rather than a scientific accessibility. And where should they be disseminated, and in what format? Good question, I think. Phil, do you want to have a first crack at that one?
Yeah, so I mean, this is part of the trust and trustworthy piece that we've been going on for some years now. What we believe and what we proposed actually is that there be a data usage report, pretty much like the way that people have mobile phone statements or bank statements. But this is a statement, and we mocked it up. We used existing flows that we know are described. GDS, the Government Digital Services, done one for a sort of prototype for what that would mean across the whole of government. So these things are entirely possible. And what this would mean would be, rather than, as you say, the actual scientific papers themselves, which may be a bit dense or inaccessible for members of the general public, you can provide the description of the project, which is part of the grant proposal sort of stage, where you describe what it is you're going to do. And I think, talking more also just to sort of Gary's point here, it's seeing from the research side the contribution to the overarching agenda of being able to explain stuff to the public. Yeah, transparency is not a burden when it becomes in aggregate, look, we're all doing this same thing, and this is helping to get more people to understand why it is. And then when there are these exceptions, as Gary says, there will always be mistakes, and those will always be painful. But those mistakes are the things that demonstrate you are trustworthy. That if you still are honest about your mistakes and say what you have done about them, and with a channel open like this, what we call data usage report, data usage statements, you are able to communicate to people in a new way. Yeah, the institutions are able to talk essentially to an individual. Yeah, there is a possible open channel. If something has gone wrong, those people who've been affected can be told and know. If your data, you're part of a cohort, you did something, or you went into a hospital at some point, years later something happens and you were part of that cohort, that can be reported back in a way that is meaningful to people. And I think we have to think about this really long sort of end-to-end process if we're going to come up with a long-term sustainable national effort. Then we need to actually get those flows right as well. So you might think of that as more data or metadata about what's going on, but I think it's as important. And the final thing was, it must be understood that all research in relation to what you're doing with the data is a secondary use of data that has been gathered for different purposes from people in different relationships. So we are always, research is always going to have this problem. And if we all sort of take it on, each research group takes it on itself to try and fix this systemic problem, it's not going to work. Everything everyone does in research has to work together so that it becomes a coherent thing, and you diminish the sense of alarm or surprise or everything over time.
Thank you, Phil. That's really helpful. I think we've got a bit of a theme here. Alex, I can see your hands up, which is great, but I'm going to try and weave some of the questions we've been asked in the chat box into this discussion, because I think we need to do justice to some of them. And so this is in a very similar way. I'm going into to Wen Haile's question, which is being transparent and honest about how data is used. But how do we track it once the data is accessed and used? Do our regulators have all the tools enabling to do their jobs efficiently? So this is kind of post-analysis, I think, really. What's being done with the results that are fine? I mean, Alex, give us an answer that off the top of your head to that question, and anything else in this area that you think is important.
I think the bit we missed out so far is that we talk about researchers and research organisations. And as a researcher, you do not get any brownie points for tracking your data for the next 20 years. You get brownie points for submitting a grant and having money and having students and publications. And from a researcher's point of view, that's where it stops. So what's my incentive as a researcher to spend time talking to the public in terms of my career kind of thing, unless my career is talking to people? So there's something there with bringing in universities, because researchers don't work in isolation. They work for a university. The data controller for the particular project they're in is the university. They are ultimately responsible for the processing of that data for that project. Universities, their lawyers, their contract people, they need to be pulled into this conversation to say you have responsibilities here. It's not good enough to use this data, publish, leave it, and that shouldn't be the end of their responsibilities. And there's also a thing that what we really talk about here is health researchers. They without being rude to anybody, not necessarily got the same skills perhaps as social science researchers who do this kind of thing for a living. It's built into their processes. So there is something there about how, again, universities can bring departments together to help each other out in terms of engaging with the public and talking to populations of people they perhaps don't normally talk with. So my plea would be to bring universities or elements of universities into this discussion about how their very distinct system fits in with data access.
Alex, that's really helpful. In fact, it kind of partially at least addresses Rachel's question, which I'm going to pose to others here, Garry and Sarah. So whose responsibility is it to ensure that all members of the public are aware of the use of their data, especially particularly in emergency situations such as this? And how can researchers, clinicians and patient reps particularly do more to prompt and support a national conversation in this? I mean, I think sometimes it might be assumed that, well, if it's TRE or something's granting access, it's their job to make sure everybody knows about what's happening, and that may be true, but maybe others have got roles here too. I think, anybody got some thoughts on this?
Well, legally, it is the data controller. We're banding around a lot of new language here. Let's be very clear. The legal requirement is for the data controller to process data in a way that is lawful, fair, and transparent. That is the first principle. There are other laws that pertain here, but that is the responsibility of the data controller, which is why we are always interested in, when people come up with new language, to unpick what they actually mean by it. Roughly speaking, as far as we can determine at this point, what people are referring to as trusted research environments are being provided by people who are actually data controllers. They may be joint data controllers, but they're data controllers. And so long as we stick within that realm, then the ultimate legal responsibility, I'm not saying that other people shouldn't, in fact I'm encouraging other people to get involved in it, but the legal responsibility is on the data controller. And frankly, we need to avoid the mistake that was made over a decade ago of allowing a piece of language like, I think it was safe havens, to be abused. Part of trusted research environment is that, when people use that language, they understand what it is and it means something. When we looked at what a safe haven meant in 2013, 2014, it was, an unsecured laptop in a shared office where, the whole of HES was being processed. And that's unacceptable. And no regulator has a chance of being able to manage that sort of thing. So let's take another go at this, a more serious sort of attempt to actually make these terms mean what they need to mean.
Yeah, thank you. Anybody else want to comment on that one? Sarah, yes.
Yeah, I'll happily come in. So I totally agree with that, Phil, from a legal perspective. However, I think there's a much bigger collective we that can do more to help. And I reflect that over the last 6-7 months or so, the country's been a lot more educated about data and about statistics. And it'd be really, really useful if researchers, when they are explaining their research in plain English, also spent a few sentences explaining where the data came from and explain the quality of it and some little contribution to how it's used in research, because obviously it's not just a dashboard that we run MI on. There's statistical processes that to run as well. And I just feel that this is an opportunity for all of us together to educate the community and the public a bit more, to make them think, well, actually, oh, how did they get to that slide that I've just seen on television? You know, there's data behind that. Where has it come from? And that would be brilliant, I think.
Yes, thank you very much. And I think that kind of leads. I'm trying to do segues. I've seen them do it on telly, so I'm trying to do segues. So Neil Walker's asked us a question, which is about how do we persuade researchers that this is not just all bureaucracy? And this is actually the fundamental behind this question is trying to help our research colleagues understand their obligations as part of the system which they are participating in. So this sort of stuff that you were talking about, Sarah, and Phil as well. How do we kind of make them understand that what they're doing is not just going through admin, but actually they are participating in a proper, trustworthy process? Is there some tricks that we could learn for how to do that better? Garry, you've been thinking deep about all this of late. Any observations on that?
I suppose I'd start by saying I'm a little worried by the how do we make them understand, which makes it feel a little bit like if I keep shouting more loudly, eventually a researcher will agree with me. I don't think that kind of thing works. So I think rather than the custodian going, we know how it should be. We've absolutely nailed this, and so you just need to bend to the will of NHS Digital's data access program and follow and fill in everything that we ask you to fill in. And I know that's probably how it feels from the researcher's point of view. But what we're trying to do is engage much more with the research community to understand, well, what is it you're actually doing? We are very sort of siloed in an end of a long process that you've probably been through as a researcher. So how does the rest of all that thing work? And what can we do to try and make this a little bit easier? I was engaged with someone very recently on a CAG application, a Section 251 application, and it was amazing to me the things that they were filling in at a much earlier stage of a process, and I'm at the end. I'm thinking, wow, why aren't they just able to copy some of this into what they tell me? Why have we sort of created it more cumbersome for them than that? So that was a bit of an eye-opener, and all the work that HDR UK are doing to try and streamline across the system will really help, I think, because that's partly driven by the research community as much as the custodians simply trying to shave together, 3, 4, 5 different processes to make them look similar. It's got to be a bit more radical than that in terms of the process.
I'd like, in our very last few minutes, to just come onto the process a bit. And the question I'm going to ask, on kind of taking a bit of a liberty, you all, is to reflect a little bit about the COPI notice experience, and to think a little bit about what the takeaways might be from that post-COPI. So what might we have learned from going through a COPI period, and what might we be able to take with us once those have gone? But before I do that, I want to just sort of just dwell on Mustafa's question really here, which I think is interesting, because he's posing the question about whether what researcher refers to in these conversations. We talk about them as presumably mainly as if they're from an academic university, but of course they don't necessarily come from universities, and particularly they come from private or corporate entities as well. Do we feel that there's any differentiation in terms of how we deal with researchers from different backgrounds, from different organizations, from different contexts? What's the thoughts? Anybody got any ideas about that? I think probably the most sensitive are commercial organizations. Sarah, please.
So I can happily come into this. So at ONS, we're agnostic as to where the researchers come from. We treat the ONS researchers and academic researchers and other government researchers, and indeed researchers from private sector the same. Everybody needs to present their research it goes through a panel. It needs to be ethical. It needs to serve the public good, and there needs to be a commitment to publishing that, publishing the research findings at the end. So the reality is that academia probably makes the biggest demand, followed by government and or increasingly more from government. But certainly the scale of academia is so much bigger than government and ONS. We have had some examples of commercial projects as well, and I started off talking about democracy. Let's also remember that that private commercial organizations make a huge contribution to our knowledge and to our democracy and to improving our services, contributing to the economy, etc. And they need to benefit from the huge investments that they make to all of us, both in the taxes that they pay, but also in whatever it is that they do, because there's a market for what they're doing. So as long as we've got the safeguards that make sure that the research is ethical and legal and does contribute to the public good, I think that we should invite them into the tent, as we do, and remember that our research is something that many people do, regardless of where they come from.
Thank you for that, Sarah. I am very conscious of time. We've got 2 minutes left, so I posed you a question, panel. So if you could just each give me very briefly in one sentence, one takeaway that you believe we're going to be able to learn from the COVID experience and help us get things better as time goes on. Just one sentence each, if you wouldn't mind. I'm going to go around the table in the order I see you, so I'm going to start with Garry.
Thanks, David. Okay, my takeaway would be be transparent, act at speed, and focus hard on what is actually important in terms of data sharing and data access.
Great.
Don't get lost in the detail.
Don't get lost in the detail. Okay, thanks, Garry. Phil.
Hi. With regard to the COPI notices in particular, I think the takeaway for me is look who actually stayed or was transparent, and look who wasn't. Who do you trust?
Thank you very much for that. Alex, I'm going to come to you next, if that's okay. What do you think we could have done?
Very quickly, I guess, be careful of sort of false promises. COPI made things easier. A lot of those things were actually very possible, very doable beforehand.
Okay, so just learn what we already knew in many ways, or should have known. Yes, good. And then finally, Sarah.
So look at the research and read it and understand it.
Good. Well, yes, proof is in the pudding. Thank you very much. So everybody, and we've run out of time now. We've got precious few seconds left before we have to return you to the main session and to go on. I hope you've enjoyed this. The time fell through our fingers. Thank you all for the questions you provided. I'm so sorry we didn't have time to answer them all. I hope you forgive me for picking a few out to ask the panel. I would have liked to have got through them all. We just didn't get a chance. But so thank you very much. Hope you enjoy the rest of the symposium. And I'm going to give a round of applause to our panelists, even though you may not be able to. So thank you very much, panel.